today we're talking about a very important topic that affects all our lives, whether we're male, whether we're female, and we're glad to have Dr. Laura today taking us through this important topic. So, Dr. Laura is the branch manager, Avenue Healthcare. She is a medical doctor, preventative medicine advocate, and healthcare management. Dr. Laura, I hope I got that right. I believe you will tell us more about yourself. And without much further ado, Dr. Laura, the floor is yours.
Thank you very much. I appreciate this opportunity to just have this conversation with you. I will not add anything else to my name. Thank you so much for the introduction. Yeah, just allow me to share my screen and we should get started.
As Dr. Laura shares her screen, if you have any questions, you can raise them once we finish the presentation. So you can raise your hand, I can be able to unmute you, or you can type in your questions at the chat section and we'll be able to address them. Thank you.
Thank you very much. Thank you so much for organizing this session where we can have this conversation on breast cancer. We are all aware that October is Breast Cancer Month, and why we set it aside, set it apart, is just for us to create awareness for something that can actually be prevented if actually diagnosed early. So the point of all these conversations is for us to be aware of what breast cancer is, what we can do about it, how we can have early diagnosis, and hopefully, of course, avert fatalities, mortalities in our population. So what is of concern in our country? As of today, the data is reading that its cancer is ranking the third as the cause of death in our country, Kenya. Before, we had issues such as malaria, diarrhea, taking the toll on our population, but now we're having cancer as the third. So it's accounting for about 7% of the total mortality. And unfortunately, out of the 28,000 new cases, we are seeing 22,000 cases of mortality being reported. So it's actually an area of concern because that means we are not catching cancers early. And if we are catching it early, maybe we are not getting the care that we need because the idea is to stop the progression. Yeah. So that is actually 78.5% of the victims who are not surviving once diagnosed with cancer in our country, Kenya. So this again is just to highlight the situation in our country and what we keep saying, early screening and detection of the cancer improves possibilities of successful treatment. So now, for us to understand or appreciate what cancer exactly is, we need to understand how the normal cells in our bodies function. We have hundreds of millions of living cells in our body. And what happens? The body actually has a cycle whereby the cells are able to grow, divide, and die in an orderly fashion. Yeah, so this is already a set cycle in our bodies. Yeah, so it's faster early in life for growth. So in the babies, it will keep dividing faster and dying faster because children are growing very fast. And in the adult ages, it becomes a bit slower because what it's just doing is replacing worn out or repairing injuries. Yeah. So now, when we come to cancer, this cycle that
Sorry to disrupt you, Doctor. We can't see your presentation.
oh my, okay. My apologies for that. Let me see. Hmm. Let me try and just share it again.
Okay.
Mm. Are we able to see it now?
Yes.
And it's active?
It's active. Move. Yes, it's active. Thank you.
Okay. So did you see not totally see the whole presentation or I can proceed?
We did not see anything once you began, since you began.
Okay, all right, yeah. So basically, just again a rerun. I was just raising up the concerns of our country, Kenya, where we are ranking cancer as the third cause of death in our country, which is accounting for 7% of the total mortality. And what we are saying, out of 28,000 new cases that are being diagnosed in our country, unfortunately, 22,000 cases, yeah, are reported as mortalities, yeah. So it's actually a very high concern in the public health sector and the Ministry of Health, because it's something that we need to be bringing down. Yeah. So we are saying early screening and detection of cancer improves possibilities of successful treatment. Yeah. So I began by saying that we need to understand what how our normal cells look like. And our cells, as I said, we have hundreds of millions of living cells in our body. And what happens, we have an orderly fashion where they grow, divide, and die. And this is more rampant in the younger ages, where the children actually have to grow in height and in weight. So there's a lot of a quicker cell growth, dividing and dying fashion, a cycle. And in adults, why that would happen is to replace worn out tissues or repair injuries. So now what happens in cancer, this orderly fashion is actually distorted in that we have an uncontrolled growth of cells. So the cancer cells are abnormal. They are not following the normal controls where we have cell growth and cell death happening. Yeah. They're invading other organs and spreading to distant organs, sometimes what we call the metastasis. Yeah. So that's what happens in cancer. And what you realize, most of the cancers, of course, will be represented as an increase in growth, with, such as a mass, what we call a tumor. Yeah. So we can have benign tumors where the tumor remains localized, though may increase in size and rarely becomes malignant. And when we talk about malignant, it means that it's cancerous, it's infiltrating the body tissues, and of course, destroying the normal body tissues as well. So with that introduction now, I would want us now to go now to dive into breast cancer. Yeah, the specificities of breast cancer. So again, the data that we are having, it's the most prevalent cancer among women, yeah, and affects about 1 million women worldwide. And we are saying one out of 33 may succumb to breast cancer. Yeah. So again, a need for concern of early diagnosis to avert death from breast cancer. So we go back to the anatomy of the normal female breast. We are able to appreciate change when we know what normalcy is. So the normal breast tissue is will have a nipple. I think we can all see that on the pictorial representation. We'll have an areola that is around the nipple. We'll have ducts, yeah, that actually help with milk production. Then we have those little green beanie things called the lymph nodes that actually also we need to understand their positioning, because when there's increase in swelling of the lymph nodes, it's also a concern because it could be a risk of breast cancer. So some of the fluids in the breast tissue drain into that area. Yeah, and you'll understand why you need to know that, especially when we're doing the self examination as well. So with that appreciation, the risk factors of breast cancer are mostly female gender. Please note, men still get breast cancer, but the higher risk is in the female population. It becomes more with advanced age. Again, a concern is that the younger age is also is getting into this risk group because of the ways of life and the foods that we are eating, and so they're getting exposed to risk of breast cancer at an earlier age. But most of the time, it's the advanced age that would get breast cancer. When there's a personal history or family history of breast cancer, maybe a grandmother had breast cancer, then the daughter might have, or the great granddaughter. Early onset of menstruation and late menopause. And why this is so is because estrogen, in women, we have something called estrogen, a hormone, estrogen and progesterone. So when we have early onset of menstruation and late menopause, we're exposed more to excessive estrogen. And estrogen has been linked to having higher risk of breast cancer. So when you have it in excess or prolonged life duration of having estrogen, you're at higher risk of getting breast cancer. Having no children, not breastfeeding again, it has to do with estrogen. And this was noted. It was a study done in nuns where they noted they got breast cancer. They had not been married, they were not breastfeeding. So what was noted, they had higher estrogen hormone. Yeah, oral combined contraceptive pills also have excessive estrogen. Hormone replacement therapy in menopause also has excessive estrogen. Obesity and physical inactivity, this is linked to all risk factors of all cancers. High fat diet as well, excessive alcohol intake and smoking, and radiation exposure. And anyone who has got benign breast disease, meaning you've had lumps previously, if you start getting lumps later in life, it is good to get checked and confirm if it's breast cancer or not. Now, we want to remove some myths from factors linked to breast cancer. We have had people talking about deodorant giving breast cancer. It does not. That's the antiperspirant. The bras that we wear do not give breast cancer. Induced abortions do not give breast cancer. And breast implants are also not risk factors of breast cancer. Because I know these are some of the things that people have been made aware to to advocate for to propose that they are actually risk factors of breast cancer. Now, we talked about breast cancer in men. It is more dangerous in men because no attention is paid to that part of the anatomy because the breast tissue is very minimal. But now, what we need to know, if there's any swelling in that area for the men, it is very important you're checked because there's no fatty tissue to buffer the progress of the breast cancer. Therefore, it would actually spread much faster. So any abnormal swellings in that region need to be checked just to make sure that it's not breast cancer. So, what is pathophysiology of breast cancer? What exactly happens? We've already talked about that cancer is uncontrolled cell growth. So, in the same case for breast cancer, yeah, there's uncontrolled cell growth in the glands, in the tissues around the breast as well. Yeah, so and the lymph nodes, as we talked about. Yeah, so that's what breast cancer is. So, it is abnormal growth of breast tissue in the body. Yeah. Now, how does cancer spread? We talked about cancer spreading abnormally. We have different stages of cancer. It can be as early as stage 0 to stage 4. The ideal, we want to diagnose when it is at stage 0 so that you can remove the cancerous tissue, because by the time it's reaching stage 4, it is spreading to other organs. So ideally, you want to catch it before it metastasizes, basically before it moves to other organs. All right? Now, we talked about the point of this conversation being detection of breast cancer early so that we can detect and actually do something about it before it becomes fatal to an individual. So we have self breast examinations monthly, both males and females. Yeah, significantly more for the females, where we say around your ovulation period, that is in the menstrual cycle, that's in the middle of the month, maybe, just to try and narrow it down, where you're able to examine your breast tissue. For men, again, monthly, just checking, is there anything that is abnormal? We look at breast ultrasounds as well for patients less than 40 years, and mammograms, which is a type of imaging as well for patients more than 40 years old, or for patients who are at high risk of getting breast cancer because of family history, or who have had breast cancer previously and it has gone away, then they get a lump again. We also have something where we call fine needle aspiration, where if there's a cyst or a lump that is found, a fluid is pulled out with a needle, it's taken to the laboratory, it is examined, investigated to find out if there's any cancerous cells. And it can also be a biopsy where they take a bit of the tissue, they literally cut a bit of the tissue and take it to the lab as well and process it and see if there's anything cancerous. Yeah. So we've talked about self-examination, which I believe is the most effective way of diagnosing breast cancer early. When we acknowledge and understand how the normal breast tissue looks like, then we're able to appreciate when we have a foreign lump or an abnormality in the breast tissue. Yeah, so you're able to actually do a self-examination. I'll demonstrate that later in a slide, in a few slides ahead. Yeah, so women under 40 with either a family history of breast cancer or other concerns about their personal risk should consult a medical professional about when to begin a mammogram. Yeah, because we say mostly we reserve it for 40 and above, but if you're at higher risk, you can even do it earlier. So you need to see a doctor if there's any lump that is noted. So now a clinical breast examination should be part of a routine checkup. So if you're doing your annual checkups every year, for example, that's something that the healthcare provider would do for you, or the healthcare practitioner. And we say from beginning at age 20, you should be able to have a clinical breast exam every 2 to 3 years. Women aged 40 and older should have one every year. Yeah. And what we are saying, if you find a lump, please do not ignore it. You had rather go to the doctor, they check it and tell you there's nothing wrong, than ignoring it. All right. So the breast self exam is basically the ability to just to look and feel the breast texture and look at the appearance, remembering the normal breast tissue. Yeah. So basically what you're looking for any abnormal lumps, anything that is enlarged near the breast or the underarm area. Remember, I said the underarm area has the lymph nodes, so it is part of the examination. You're looking for any changes in size or shape of the breast or the symmetry. Yeah. So if you know that by you appreciating the normal breast anatomy that you have, you will actually note if there's a difference even in the size, maybe of one breast in comparison to the other suddenly, which was not there previously. If there's any puckering or dimpling, like an orange skin, you know, the way the orange skin pulls in or a lemon pulls in, if there's that dimpling, that's something that is abnormal. We need to check. If there's any redness or any ulcer, basically an ulcer is an opening of the skin that's already removing pus, removing discharge. That also is an abnormal thing, of course. And any discharge from the breast that is bloody, not the usual. You're not breastfeeding or anything, but you're just leaking a certain type of fluid, and might not always be bloody. Again, if there's anything that is discharging from the breast, again, getting checked and finding out, is it harmful or not? Yeah. So we are saying if you find a lump, do not panic. The idea is to examine so that we can go and find out if there is anything else that is going on. Yeah. So we are saying any changes that you see or feel on your breast does not automatically mean you have breast cancer, but it is best to report any change to your physician for further evaluation. So not everything you find will be cancerous, but everything that you find is worth going for a healthcare review so that we can see what's happening. So the basic steps to breast self-examination, yeah. Um, the first step, you want to stand with your shoulders straight, facing a mirror. Of course, you've exposed yourself to the waist area and you're looking for any differences in size, as we said, shape, color, swelling, or bulging of the skin, changes in the nipple, or any signs of redness or rash. Then you raise your arms and examine your breast for any of those differences. I will show you a pictorial representation of what I'm talking about, and then gently squeeze the nipple to check if there's any discharge as well. If you choose to lie down on your bed or on a surface, again, you will pull one arm behind the back of your neck and use the opposite arm and fingers to examine the breast tissue. Yeah. And you will do again the opposite arm and do that again. You can still do it when you're seated up on a bed as well, and just raise one arm as well and do the palpations to see if there's any changes in the breast tissue. So right here, this is what I'm talking about. So you can lie down. Yeah, so one arm is always behind the head. The opposite fingers, usually use the finger area, tip areas, because they're very sensitive. So you can palpate and see if there's any difference. Most of the time, you try and divide the breast tissue into like 4 imaginary portions so that you don't miss an area. That's the only logic to that. Yeah. So you can do it while you're standing as well, as we've talked about. And remember always to check the nipple to see if there's anything else that is discharging from the nipple. So when do you see a doctor? Remember, we've said you're the one who is going to be able to examine your breast tissue with the understanding of normal breast tissue so that you're able to appreciate what is abnormal. Yeah, we are talking about it being done in the mid cycle of your menstrual cycle. Yeah, and what we need to note, it is normal to feel tenderness and other standard cyclic changes during your ovulation. But I keep saying anything that is abnormal, get it checked. Let us say that that is a cyclic change rather than it's something that we could have noted earlier. Yeah. Then also lumpiness is also very common during the menstrual stages, especially in the younger girls. They might notice some lumps which are not usually cancerous. But again, if something is giving you discomfort or you're uncomfortable with it, we say we need to get it checked. Most of the time, it will be normal breast tissue, and the lumpiness that you note also during the menstrual cycle is also not most of the time just normal, and it will disappear as soon as your menstrual maybe cycle at that point is over. This breast tissue just comes back to normal. So when you see a doctor, when you find anything abnormal, it's the time to see a doctor or a healthcare provider. If you notice a lump is different in size, maybe today it's this size, after a few weeks it's increasing in size, that's something that you need to go and get checked. If the consistency changes, maybe it was smooth, now it's feeling lumpy and it's persistent, yeah, you need to get checked, because there are lumps that come, they're infectious, they are treated with antibiotics and they disappear. Postmenopausal women should see a doctor right away if they notice any form of lumps immediately. Yeah. And then in addition, if you see changes in the nipple, the breast textures we've talked about, if there's prolonged itching or swollen underarms, the lymph nodes, they're itchy and they're always swollen, it's good for us to check to see a doctor and see what's going on exactly. Yeah. Please note, pain most of the time is not associated with breast cancer. By the time you're having severe pain, usually it's at end stage. So most of the time in the beginning, there will be no pain. So don't wait for the pain. Any lump that you find, go and get checked. If a lump is painful, most of the time it's an infection which can clear in a few days. Yeah, but pain is not usually an alarm for cancer. It just might be something else that's happening that we need to check out and treat. So this is appreciating the different changes we've talked about. So there could be a lump, there could be skin dimpling. Just keep imagining an orange peel or a lemon peel, the way it keeps to dimpling inside. There could be changes in the nipple. They were probably normally, they start to pull, which was not the norm before. Yeah. Or there's changes in the texture, and you touch, you can feel something is different on that area. And if you find any bloody fluid or leaking from the nipple, these are signs that you need to get checked for breast cancer screening. Yeah. So these again are the different stages we talked about. Again, we're still saying we want to get it at stage 0, where we have 100% survival rate, rather than stage 4, where it has spread to the other organs. And if you notice, by stage 4, we have a 16% survival rate. So again, the point of this conversation, early diagnosis, early detection, for us to save lives as well. Yeah. So what happens if you find a lump? If you go to the doctor and the doctor tells you they're suspecting maybe something cancerous, or they want to do further investigations, what are these investigations? What are you expecting exactly? Yeah. So sometimes it could be, remember, this is after investigation, probably we found already the cancerous cells. So what are we doing? Yeah, we have been told maybe it's a certain stage of breast cancer. What do we do? What could be done? So sometimes surgery might be done, where they will go and remove the specific lump and just take it out. Sometimes it might be extreme, where they take out the whole breast tissue. Again, this will be dependent on the staging of the cancer. There could be chemotherapy, where they just used medication, usually through the vein, to actually basically kill the abnormal cells. There could be radiotherapy, where we use rays to also kill down the cell cycle. Remember, the abnormal cells are multiplying in an uncontrolled fashion. So you want to reduce that multiplication. Then sometimes hormonal therapy to reduce the estrogen levels might be used as well. So sometimes it might be done as a single management, but most of the time it's multidisciplinary, where you'll find a whole team doing different therapies to try and just stop the progression of the cancer. Yeah. So again, it depends on the spread after diagnosis, after staging of the cancer. And we keep saying early detection is what we are advocating for. So how do you reduce your risk? So the screening you've seen is very simple. Especially the men will just see it if it is there. The women, we have talked about every month doing your self-examination. knowing your family history, if there's a risk factor, just knowing what you need to do, what you need to prevent. You need to be maybe working out, eating healthy, doing regular screens, yeah, to make sure there's no lump that is forming. Eating the balanced diet. Remember, the good food, good nutritious food also makes your body have high immunity. It's able to fight some of these overgrowths. Getting regular exercise, because you'll have reduced calories and reduced fat deposits, so less risk of cancer as well. Don't smoke. Smoke has been associated with every form of cancer. It's not useful, it's a risk. So, of course, don't smoke, or if you're using tobacco products, maybe try and stop it, reduce, but progressively you want to actually, the point you actually want to stop smoking altogether. Then, of course, avoiding excessive alcohol consumption, because it 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 uh, it introduces toxins which make you at risk of having cancers and all that. Yeah. So you want ideally just to be taking care of your body in a holistic way. Yeah, to reduce the risk. Yeah, we've talked about physical activity, and what we are saying, at least 150 minutes per week. You can spread out the form of exercise that you will take, and it actually says when people work out, when people who are at risk of cancers, it's reduced actually too significantly. Most of the breast cancers, colon cancers are associated with physical inactivity and obesity as well. Yeah. So make sure the exercise is actually of quality, where you're actually exercising, increased heart rate, and getting a workout done as well. Yeah. It doesn't have to be the gym. It could be something as simple as walking. It could be something as simple as running, cycling, whatever works for you. But what we are saying, do something so that it just keeps your body healthy and avoids a number of these conditions that we are seeing today. A diet, food selection is very key. Eat the right foods. Try as much as possible to do whole foods. I know there's all these GMOs coming and all these chemicals in food, but we try our best to just choose the right foods to eat. Food portions should be right, because with food portions comes weight increase as well. So you want to take the right amount of food so that you're not taking excessive calories. Cooking methods, avoiding processed foods, avoiding excessive oils in your foods. Yeah. And just basically eating the right thing at the right time. Yeah. And also throwing in enough water, which is about 2 liters of water every day. Yeah. So that we are just our body is healthy and able to fight and have a good immunity to fight some of these cancers and conditions that we see today. Now, should we find we talked about different management that can be done when we find breast cancer. Yeah. So the idea of treatment is to slow the progression and reduce the complications of this breast cancer. And of course, we want to choose the most effective treatment and adequate treatment so that this can be controlled. And we talked about it being combined in modalities. Yeah. So that's the management. Yeah. So when we talk about palliative care, basically what we are talking about is if we are not able to stop the progression of the cancer, we want to keep the person as comfortable as possible and be able to reduce the pain. And both management and palliative, we are using integrated health services. So it will not only be the doctor, the nurse, to be a doctor, maybe a nurse, specialty in oncology. There could be a nutritionist as well. There could be a surgeon as well in this team. So it's very integrated. Also, therapy is very key. Mental health is very key when you're going through these treatments, and also palliative care as well, both for the patient and the family that is helping take care of the patient. Yeah. So in palliative care, we're just relieving the symptoms rather than curing. And it's an urgent humanitarian need for people in advanced stages of cancer where there's little chance of cure. So what we're excited about, yes, we have cancer survivors. There are people who've been detected early, they've gone through the management, they are cancer free. But what we say does not stop there. You continue to do your exercise, to eat a balanced diet, you continue to maintain healthy weight, getting good sleep, reducing stress, avoiding tobacco, limiting amounts of alcohol. So you continue taking care of yourself. And what you'll notice, you'll be called in for regular checks to just keep checking the cells in your body to make sure there's no recurrence, to make sure the cancer is cleared completely. So you'll continue to see, in the beginning, it might be maybe every month, then goes to 3 months, it could be 6 months, and maybe even once a year, just to make sure that we are actually healthy and there's no recurrence of the cancer. So prevention, we are saying reduce stop alcohol and tobacco consumption. We talked about exercise, balanced diet, avoiding non-processed foods, of course, managing post-hormonal therapy, reducing hormonal exposure, breast cancer screening. Yeah, that is very key because again, we said early detection is what we are advocating for. Yeah, so we've talked about breast cancer screening again. It's easy for us to do it on our own. They're the annual checkups that we do. 40 years and above, we are doing a mammogram. 20 to 30s, we can do the clinical breast exam, maybe a breast ultrasound. If there's risk factors of breast cancer in the family, then we can do a mammogram as well. Yeah, so a lump should never be ignored. If it's found, as we said earlier, just make sure it gets checked. Yeah, so this is just emphasizing what we are talking about. Not every lump is cancerous, but every lump needs to be investigated. Yes. So what we are saying, we've had a conversation about the demographics of our country, the concerns we are having, what cancer cells are, the risk factors, the early screening, the management. So it's a very extensive conversation. But today what we are doing is just touching here and there for us to be aware. We're just bringing awareness to the table because what we are looking at, our hope is to have early screening and detection of cancer. We are hoping to prolong life by averting death through medical treatment and supportive care. And if cancer progresses, we are hoping to control the pain. That's what we talked about called palliative care. And we hope for treatments, of course, in science. There's a lot of research being done for us to find cures, to see if we can actually stop cancer altogether. But that is still ongoing research. Yeah. So the idea of the conversations, again, is to just create awareness for prevention and reducing the risk of cancer and other cancer burdens in our society. Thank you. So I'll take questions with that. Asanteni.
Thank you. Thank you so much, Dr. Laura. That was very eye-opening. Uh, members, please feel free to type in your questions in the chat section. If you have a burning question, you can also raise your hand, and I'll be able to unmute you. So, Dr. Laura, Felix Otieno had asked a question here, and he says, "Why are women more at risk of getting breast cancer than men?"
Thank you very much for that question. So what we talked about, one of the risk factors in breast cancer is excessive estrogen. So men have very minimal traces of estrogen. Men usually have testosterone, right? So because women have more exposure to estrogen hormone, it is what has been associated with risk of breast cancer. So it is more common in women. I hope that suffices for you.
Thank you. Thank you so much, Doctor. Feel free to ask questions. The doctor is here for us. Let's make this as engaging as it can be. Raise your hand. You can raise your hand or type your questions in the chat section.
I see a question. Is there any relationship between microwaves and cancer? Thank you for asking that. Well, they have been, I would say they are more of myths because the radiation that is used in the microwaves is very minimal. The radiation that makes us at a higher risk is mostly the one from radiation centers, maybe for excuse me, staff that work in radiation centers or industries that are exposed to high radiation. But the normal microwave, the normal rays from our phones, yes, they have radiation. Excuse me for me. Yes, they have radiation, but would not be the risk factor of cancers in this case.
Thank you. Thank you, Doctor. Any other question? I see one from Irene. She says, please expound more on HRTs causing breast cancer. How can someone on HRTs avoid getting this cancer?
Thank you, Irene, for this question. So again, the HRT is the hormone replacement therapy that is being used in post-menopausal women. So what happens? It has estrogen, so that you can avert the side effects that come with menopause. So now you getting more exposure to estrogen is the concern in this case. Not every person who's on this therapy will get cancer, but they would be at a higher risk. So if someone is already on the hormone replacement therapies, of course, again, it's always good. It's not something you'll continuously take, remember. So it's good for you to keep engaging with healthcare practitioners, with your gynecologist to know when you need to stop it. And of course, the regular checks are very important, especially since we said in menopausal women, any lump um, needs to be checked. Then they have to regularly do the annual mammogram to check if there's any lesions that are there. So that is the only way we'll be able to find if we have cancer. But ideally, again, it's not a therapy you want to continuously take each and every day, just maybe for a certain duration of time, and then you stop it.
Thank you, doctor. I see Dee has raised her hand. So, Dee, kindly unmute yourself so we can hear your question. Dee, are you there?
Yeah, I'm here. Good morning.
Good morning.
So my question goes, if we have a patient with breast cancer, patient got diagnosed in stage 2, patient got surgery, mastectomy, went through chemotherapy and radiotherapy. And then after the PET scan shows there is a remission. Is there probability of it recurring, and how long can we prospect for it to recur? Thank you.
Please unmute yourself, doctor. We can't hear you.
Oh, sorry. Thank you very much for asking this question. Of course, there's always the risk of remission and the risk of even cancer in other organs after getting a specific cancer at some point. So the ideal is to keep, of course, going for your checks. If there's remission, treatment will still be undertaken. We cannot exactly say if it will be full-blown remission, when it will actually remit. We cannot have that. We don't have that data because it depends on how the body responds to the treatment and if there were any cells that may have maybe gone into other tissues that were not caught earlier. So it's a very gray area. We cannot really say this is the time we expect remission. This is we're expecting it to recur at this point. We can't really say that. So what we say is what I talked about, having regular checks. Yes, the PET scan is good and the regular therapies and checks with all the healthcare providers so that we can avert maybe the progression if remission does come back, yeah. I hope that suffices.
Thank you. So we have another one from Caleb. He says, do you recommend herbal treatment for breast cancer?
Thank you, Caleb, for this question. So what I say, herbal treatments, again, yes, there are studies that show that they help with management of conditions, but not treatment of breast cancer, in that they help the body detox. But again, I am very hesitant to say go for herbal things to maybe detox and all that, because they have to be approved by the board. They have to be FDA approved to make sure that they actually can help with detox. And some of the things that are being taken are actually more harmful and actually do not even stop the progression of the cancer and even end up injuring even the kidneys and the liver. So there's no herbal treatment that will clear breast cancer. Some treatments, yes, herbal treatments have been tried in different places where they say it helps with detox and building up of immunity and all that, but it will not clear the breast cancer itself. Yeah.
Thank you. We have another one from Frisha. She's asking, are oral contraceptives the only one that increases the chance of breast cancer, or all contraceptives?
Thank you, Frecia. So oral contraceptives have estrogen component in them, That is why they increase the risk of getting breast cancer. The other contraceptives usually have very minimal hormonal components. Some may still have, of course, the implants and all that, but the amount of estrogen that is in them, incorporated in them, is very minimal. But oral contraceptives have a high dose of estrogen. So they're the ones that are actually associated with higher risk of breast cancer.
Thank you. Leonard asks, how accessible is cancer management in Kenya, especially in terms of cost?
Um, well, we have noted the burden of cancer in the countries is quite high, because our facilities may not have all the necessary equipment and diagnosis that we have, but early screening is still possible at primary level healthcares and also self-screening as well. In matters of cost, of course, it is very expensive in the long run. I know NHIF has tried to come in their facilities, and we have programs that are trying to give free treatment for some of these cancers. But then again, it's on, we don't have, I know the cost burden is high on everyone, both the family, both the country, both the hospitals, but it's something that is being looked into to see how to make it more affordable for people to get treatment on time as well, so that we can actually reduce the progression. But this definitely is one of the conversations that's being held in universal health coverage, to see how do we take care of the cancer treatment costs? How do we make sure diagnosis is done on time? So this is a conversation that we are having. So far, I know what is being pushed for is early screening awareness, even as we put systems into different facilities to take care of this management. But this is an ongoing conversation. It's not yet perfect. It's not where we are hope we're not where we want to be, but every day is an improvement.
Thank you. I see Shakila Kenyi has raised her hand. So Shakila, kindly unmute yourself and ask your question.
Thank you so much. Doctor, I do have a question concerning cancer in general. And I wanted to ask the fact that we do have genetically modified products. I don't know if it's among the factors that really increases cancer. So I just wanted to know if maybe you avoid all this in your lifetime. Will you be safe? But in the current era, we can't really tell when it comes to all these products and everything coming up. So I was just asking if maybe you exercise and do the right things in the near future. Can you be guaranteed that you can really escape cancer?
Thank you for that question, Shakila. Um, I don't want to say we are 100% guaranteed that we will not get maybe cancer if we do everything right. But what I'm trying to say is that we can do something. We don't want to say we could have done this. Yeah. So I'm not saying if you do everything right, you're 100% cancer risk free, but at least you alleviate the possibilities and the risk of getting cancer. I know there's a lot going on. There's all these modified things. We are told they are safe. I don't want to comment so much on GMOs because I don't have the data on the plate with me, but it is supposedly said that they are supposed to be safe for human consumption. But what we look at on our day-to-day lives, there are things that we can avoid. For example, like processed foods, we have a choice whether to continuously buy like sausages, that's processed foods, yeah, that make you at higher risk of getting cancer. Or can we buy normal meat? Are you getting? Yeah. Can we buy less smoked things? Because most of those processed meats are processed with chemicals. They are smoked a bit, making them have higher risk. So which choices can we make that we can help us reduce the risk factors? I think that's where I'll leave it at. Yes.
Thank you. We have another question from Nelly. She's saying, if you have a family history of, say, colon cancer, should you be on the lookout for any other type of cancer like breast cancer?
Okay. if you have colon cancer that is already active, yes, it can spread, but you may not be at risk of breast cancer per se. But what I would say, it is good to keep checking. That's why we're talking about the screening, yeah? So if you have any history of cancer, it's good to keep doing the screening, like breast cancer screening, self-examination. If there's issues that you're finding maybe with your stomach, with passing of through, just go and get checked, yeah? But it's not saying everyone maybe who has this cancer is at risk of this other cancer, but it is good to get checked, yeah, because of possibilities of it going to other organs. Yeah.
She was talking about family history.
Or family history of colon cancer, should be on the lookout
Yes.
for any type of cancer.
Yes.
You should be on the lookout more for colon cancer. Yeah. But keep screening for everything else. So I would say the common cancers in our country would keep screening for them, but it's not a direct risk factor. That since you're at risk of colon cancer, you can get breast cancer. I would be more worried about the colon cancer itself.
Thank you. So Felix asks, please explain the difference between mammogram and ultrasound and eligibility in terms of age. Which one should be done first?
Thank you very much for that question. So the ultrasound will use sound to get images. The mammogram will use X-ray radiation. Yeah. So what we are looking at in different ages in women, the breast tissues are a bit different. Yeah. So as you grow older, usually from above 35 going to 40s, there's a bit of calcifying, like fibrosis, hardening of the breast tissue in comparison to the younger women. So you find when you use ultrasound in someone greater than more than 35 years or 40 years of age, you might not get the exact readings because most of the tissue is already a bit hardened. So you might pick lumps that are not even there, yeah, on imaging. So what we are saying for ultrasound, it's advocated for women between 20 to 35 years of age. It can be done every a year if there's a risk of possible lesions, but it's harmless. It just uses sound waves. The mammogram, we reserve it for the older women, as we have said, because of the changes in breast tissue. But for women who are at risk of breast cancer because of family history or have had breast cancer previously, if they find a lump and they're between 20 and 30, we would use all of them. We would start with ultrasound first and then still do a mammogram to see if there are any other changes that may be noted. I hope that clarifies it.
Thank you. Macduff says, great talk, Dr. Shiundu. Kindly comment on diet fads, e.g., soya beans and breast cancer.
Okay. All right. And I think he has, well, we'll go to the next question after that. Yeah. So
Yes.
now what I propose, I do not advocate for fad diets. I advocate for healthy eating daily. Then we don't have to go into any crazy diets of taking too much of something or something in excess. And breast cancer. So I know there are relations that have said maybe taking too many of maybe soy and all this can expose you to breast cancer. But what I would say, can we have a balanced diet daily? Then we don't have to go into crazy fad diets, because already sometimes when you go into these diets, you take your body into stressful situations because you're not taking the right nutrients at the right time. So if you eat healthy every day, you don't have to run into a fad diet. Yeah. And then I see continues to mention, but there are existing braziers that have metallic implants, especially for well-endowed ladies. Could it be at risk of breast cancer? As I said earlier, studies that have been done have shown that there's no risk factor associated with the bras and that metallic substance, and even normal implants that are being put actually physically by plastic surgeons. They say there's no related risk factor. It's actually supposed, it's known to be a myth.
Thank you, Doctor. I see, Dee, you still have your hand up. Do you have another question?
Hello.
Yes.
Yes, I have two questions.
Okay.
My first question is, in the breast cancer treatment, we have the chemotherapy, radiotherapy, hormonal. And right now we have immunotherapy for the triple negative breast cancer. How effective is it? My number two question, there is this myth that alcohol intake in ladies is somehow related to breast cancer. How true is it? Thank you.
Thank you very much, Dee, for those questions. So the first one, what I talked about earlier, with diagnosis, the healthcare practitioner, the oncologist, will be able to stage the cancer to begin with and choose the best combination of treatments. Yeah. So they can be effective on their own, they can be effective in combination, depending on the staging of the cancer. So I cannot say only this one will be effective or this other one is better than the other. Usually a plan is made by the team, the oncology team, and they choose the best treatment, possible treatment, as per their diagnosis for the individual going through the therapies. So they are all effective depending on the staging, depending on the needs of the patient. Yeah, so all of them can be used. Yeah, but depending on the choice that will be made. Secondly, you asked a second question. Kindly repeat the second one about alcohol. Sorry, about alcohol intake. So basically, taking in of any form of toxins, yeah, be it smoking, drugs, alcohol, predisposes your body to cancers and other conditions. So when you weigh the pros and cons of taking alcohol and smoking and all that, sometimes you'd rather just put them down because they have all these risk factors of all these things. So it's not specifically only for breast cancer and women. Actually, in all cancers, it's still a risk factor as well, because apart from introducing toxins and compromising the normal physiology of the organs, it's just a toxin on its own. So basically, the pros and cons of taking it, if you can avoid it, why not? But it's not specifically related to women and breast cancer. Yeah.
Thank you. Thank you so much, Dr. Laura, for taking your time and taking us through this topic. We've truly learned so much today. I can say this on behalf of all the members who have joined us today. And we hope to have you again so that you can, shed light on different topics that will help us be better. So before we conclude, I see our General Manager, Davis Ongiro, here in this meeting. Davis, if you will say something to our members. Davis, are you there? Okay. As I was saying, Dr. Laura, thank you so much. I know many people have been asking for the presentation. They want it shared to them. I know once you registered for this webinar, you are able to put in your email address. So we'll be able to send it to you. Davis, you here?
Yeah, thank you so much, Elizabeth. I think I wanted to thank all of us that have managed to attend and to give words of appreciation to those who are in the front line, ensuring that they take care of our people, those caregivers, those who are supporting patients in one way or the other. But lastly, wanted to say we are doing these webinars every other month, and one of the things we do, we also have a solution. So when you need a medical cover, we are able to help you deal with that. So in case you need a medical cover, in case you need a quote, we will be texting you the email address where you can request for the quote so that you can be able to get a quote and see what it covers. For those who already have the disease, it's treated as a pre-existing condition. So it is always good to ask your consultant uh, what is the limit for pre-existing conditions so that they can give you enough information so that you can be able to, the cover can be able to assist you. So thank you so much, everyone who joined, and thank you, Daktari, for doing a very good work. We really appreciate, and we're looking forward to many more engagements in the future.
Thank you so much, Davis. Laura, any last words for us?
Thank you so much for organizing this much needed conversation. And we will continue to stress in that early detection, early diagnosis actually averts death. This is something that we can all do on our own. So I would advocate this is information you can share to even your friends, your family that are not here. But this is something that can be detected early and actually be taken care of at an early stage. So let's keep safe and let's keep healthy. Thank you very much.
Thank you. Thank you so much. I see, Janet, you're asking for the recording. Once we send the presentation to you, we will share it with a link of this recording, which we will upload on our YouTube page at Octagon Africa. Once you search Octagon Africa on YouTube, you'll be able to find our page where we will upload this in the course of the day. Once again, thank you also for taking time and joining us in this webinar. As Davis mentioned, we do this every month. So we look forward to having you in other conversations that are ahead of us. So I want to wish you a lovely rest of the week and a blessed day. Thank you.